So, ladies and gentlemen, we are jumping into the last phase of our web conference. We have organized a short panel discussion with Hans Härting, whom I already introduced, with Franz Allerberger, who will sit in for Dr. Reich, the Chief Medical Officer. She is still with the Chancellor, and Markus Müller. I did not introduce him yet. He is the rector of the Medical University Vienna, and I think this is the most important thing to be said. Do we have Markus already online? I know that Markus has to leave at 6:30 sharp, and that's why I would like to start this little brief discussion with a question to Markus. I mean, the Medical University was recently nominated the 27th best hospital in the world by Newsweek, which is not an insignificant journal. First of all, congratulations. This is really an honor and a big achievement. And secondly, you're one of the leading education institutions in Middle Europe and in Central Eastern Europe, educating doctors. Do you see, with the COVID pandemic, do you see the need to increase the education in hygiene in your university?
Well, I think we have to adjust it at least. So I would refer to COVID as, first of all, a great stressor for us all in many different aspects, but also I would refer to it as a great teacher in many different aspects. And I think there are a number of lessons to learn, well, for us all, and certainly also for educational institutions like universities. So when talking about Semmelweis, I'm reminded of historical context. And I think one context is also related to our university. I don't know if you're aware of the name of Van Swieten. He also had to struggle with what we today would call fake news. So kind of irrational thinking. And I think this is something that is very prominent also today in all our discussions, and this is causing a lot of turmoil in our discussions. And at that time, people were thinking of witches and vampires, and Van Swieten was even sent to Transylvania for the Empress to check out if vampires actually exist. And he came back with a very famous account noting that vampires do not exist, which led the Empress to a formal statement that people should actually not go on with their fake news. And something similar, or I think history does not repeat itself, but I think it mirrors itself in a certain way, or it rhymes itself. The second, I think, thought that comes to my mind is Maria Theresia herself, because she wanted to implement the smallpox vaccine at the time. So it was we were talking about the end of the 18th century, and she faced brutal resistance, also from very, I think, learned persons like Immanuel Kant, who wrote an account against vaccination. And also here we can see, I think, a similarity. And also when talking about Ignaz Semmelweis, who I think was actually the first one I'm aware of who proposed non-pharmacological measures against an infectious diseases in his famous account on childbed fever in 1861. I think he faced similar resistances because people simply were not believing what the case he was making, although the documentation was extremely good at the time. And I just gave a presentation last week for the European Congress of Radiology, where I also highlighted, and I actually showed that's because I know the dates. I don't know them by heart. It's just because I had another talk last week. So that in 1861, in this famous little booklet, he presented this table with the death rates, which was a very important piece of epidemiology. So to sum my point up, I would say it has not dramatically changed. So actually, the problems people were facing, let's say 200 years ago, were not so much different from problems we are facing nowadays. although I would say that the focus of medicine has to be readjusted a little bit. I think we have all witnessed the last couple of decades where we had a very strong focus on oncology, and in the 90s it was cardiology mostly, and infectious diseases were a little forgotten. So people, I think, were led to believe that there's not much more to learn. And coming back to my initial statement, I think in this regard, COVID is a big teacher that certainly, and I think this is a very well-informed audience, and we know it certainly better than many others, but that there is a comeback of infectious diseases, and we need to take them and treat them seriously in many different aspects. So when it comes to education of students, when it comes to our course plans, but far beyond that. So I will stop here and give back to you, Bernhard.
Thank you very much, Markus. And I totally agree. This fake news stuff has been dramatic. And when it was the vampires with Van Swieten, it was the cosmotelluric forces with Professor Semmelweis. That's something that we are still struggling with today. And Professor Pité at the beginning, at the introduction lecture, he said we have to fight the pandemic and we have to fight the infodemic. And this is exactly this point. Hans, I would like to hand over to you. Hans, you said that something that is missing in the hospitals, and one of the biggest problems in the hospital, is that they don't have a training department. Because if you train properly, you can save a lot of money in the hygiene field. And now Markus says, well, everything has to be a little bit adjusted, but otherwise it is fine. How would you comment this, Hans?
Yeah, it's there are tendencies that the medical system would like to go direct or headed to become a high reliability organization. And 30 years ago, aviation proved that without training and taking care of the behavior of the people working and running the system, the transition will not take place. And there is a major misunderstanding, which is obvious to me the last couple of years, visiting hospitals and working with doctors and nurses, that we have a bureaucracy, basically, which is a safety bureaucracy. We care about incidents, about reports, about errors, but we do not basically go to the root of it. And just today, there was a newsletter that came out from the Agency for Healthcare Research and Quality that they say that they have to add something to their root cause analysis, and that's the human factor tool, the HFACS tool, and they have to take care about why people behave, how they behave. And one misunderstanding which is really important is that standardization in logistics is nothing which takes the freedom away of the people working the system. Bureaucracy kills safety, but if people understand why they have to stick to certain safety relevant rules, if they understand it, then they stick to the rules. And currently, this is mixed up. People think if safety relevant rules and hygiene rules are the most important, talking patient safety, that this is not applicable to me. I'm taking care anyway. And if we do not get that basic understanding that standardization in safety is saving lives, and that we need to adopt to situations because every patient is different, every situation is different. We need to reduce bureaucracy. We need to reduce those 100,000 rules there, which nobody knows. We have to make it easier. We have to reduce complexity, but we have to care for understanding why certain things are so important. And since the French Enlightenment, we know that education and insight is that what helps people to do the right things right. And currently we have, we're talking patient safety education, we have in a curriculum very, very few time for that. And in the high reliability organizations, we spend a lot of time talking why errors happen, why mistakes happen, why standardization is important, why resilience is important, why interpersonal competences are important. And that's approximately the point.
Absolutely, absolutely. But would you? This is something that is not directly linked into the education of doctors, or do you see a necessity to add something of this topic to the basic education of doctors?
Yes, of course, I demand it. A couple of years ago, I was sitting together with the Ärztekammer, and I said it's very interesting that hospitals are operated by doctors and nurses together, but their education is totally separate. And then they meet in the ward, at the station, in the surgeon theater, and they don't know how to communicate with each other. They have different languages. They have different levels of knowledge in certain fields. But how to work together, how to address problems properly, how to care for respect is no content. And this is just, it's not, this is something we could improve.
Markus, would you agree? Markus, would you agree to this?
Well, I'm glad to listen to Hans Härting. We had a joint endeavor a couple of years ago, and I highly value all his approaches as a former pilot and an expert. Content-wise, I fully agree. I would say. On the other hand, so I think we are old enough to understand what a dialectic principle is. And the dialectic principle is, I think that at certain times you have an exaggeration of certain, I would call it forces. And I fully agree that all this kind of bureaucracy and documentation like tendencies with ISO excesses and so on have not only provided, I think, good for organizations in general. But I think this was a certain dominant principle that all of us had to face and at times also to suffer from. And I think this will change, like so many challenges we face. So I think also COVID will probably contribute to this change and will start a dialectic process, probably also in this direction Hans was pointing out.
Yeah. No,
but we're not there yet. So I think it's a process.
It's a process.
It's a vision. I would say it's a vision or an additional aspect which will probably be more pronounced, hopefully, in the future. But there's a lot to be done because it's not. And I fully agree. Also, this problem it's not run by nurses and doctors. Yes, we know that the economy has taken over, unfortunately. And I think we need to gain back some of the terrain until we can start talking seriously about all this.
Yeah. No, thank you. These were quite open words. I would like to involve Franz in the discussion. Besides being the head of public health at the AGES, Franz is a teaching professor at the university in Innsbruck. Franz, how do you see the training, the education of doctors to really get better involved in this hygiene issue, antibiotic stewardship issue, process issue, logistic issue, all that we have heard so far?
I think in the last 40 years and also in the last 20 years, there has been a huge improvement. So it always depends where you start. I remember when I was in training as a consultant in hygiene, as we call it, I was once ordered to my boss, and he told me, it came to my hearing that you claimed during a lecture at nurses, I was teaching nurses when you start to teach with nurses, that you claim that we have nosocomial infection in Innsbruck at the university clinic. It came to my knowledge that you claim that we have nosocomial infection. And my boss was the head, he was the hygiene professor at this university. At this time, there was still, and this is only 30 years ago, they were convinced that a nosocomial infection is something bad, someone hasn't washed his hands like Semmelweis and caused the problem. This has changed completely. And especially what we now have in Austria is a legal situation which started 20 years ago. In 2002, we were allowed, financed by the Ministry of Health, who organized the project manager, to come up with pro-hygiene, pro-Hyg, as it's called in German. And now, as of 2013, this is part of a treaty. It's not law, but it's part of the Zielsteuerungsvertrag, of a treaty between the federal government and the provinces, and connecting funding with proven establishment. And to me, it has changed. Now I see in hospitals how efficient these special nurses, some of them are biological technicians, they actually are able to teach the people at the job. They are able to change situations. Establishing benchmarking of nosocomial infection is no longer considered nest spoiling. In fact, they are accepted, and if they show a benchmark which is above the average, they can discuss and start actions. So I think it has changed very, very much. And I think the field of hygiene, we learned it from the intensive care specialists. Intensive care specialists in Austria started to compile data on nosocomial infection, pneumonia in persons with artificial aspiration. This pneumonia data were much higher than in Switzerland, and they actually changed the system, took over what the Swiss specialists did different. So I think hygiene has learned, has improved, and these teams, and once again, hygiene teams are nurses, medical technicians, and physicians, have to be very high acceptance. I'm really proud to see the acceptance of this stuff in the hospitals, because if you look back 30 years ago, this was completely different. It was a denial, and this is, I think, where the improvement is. You have to stop denying a problem in order to approach it. And once again, it's training. You have to accept mistakes and not blame somebody. And therefore, I think this blaming culture, I think we are at the bridge of switching from the old blaming culture where I come from to the new people who point out mistakes and are not afraid of showing that something went wrong in institution without being afraid.
Thank you very much. Sounds extremely encouraging, but it should not hide the fact that there is still a way to go. And Markus pointed it out. We have to adapt. COVID could be a good teacher, but let me for a second, it seems that we are discussing something that is of interest for the people, and I will just read 2 comments that popped up in the chat. First of all, multi-professional work is something we should embrace. It is a richness to have so much qualified people working in the same place. We should all respect each other, whether we are nurses or doctors. So we are getting good support in our discussion from our listeners. And the second writes, thank you for demanding the students are trained in safety. A self-efficacy of protecting their facial mucous membranes, teaching hand hygiene, behavior awareness will serve a harm reduction strategy for patients and staff. Just wanted to put this in because it seems that we are discussing around a very important topic. Let me just throw in a second thought and get Markus' view on that. Markus, we heard during the course of this symposium examples from hospitals in Austria, in Serbia, in Croatia, and in Hungary about setting up strategies to handle this COVID situation, defining the routes, how the stuff moves, how the patients are moved, how goods are moved, turning ICUs into COVID ICUs. And it was amazing to see how creative people were to really solve the problem. And Franz, in one of the lectures, said, "Well, we have to improve to work together across borders." Is there any idea of linking the medical systems closer together in the Central Eastern European region, so that not every hospital has to invent the wheel, but people can learn from each other?
Okay, well, I have 2 thoughts on this. So I think also in that regard, COVID was kind of
a teacher,
a
challenge,
but with a message that was not at all reassuring, because remember what happened like a year ago. I think we all witnessed exactly the contrary of what you described now, so that we saw that international collaboration essentially collapsed. Probably not at the level of experts. There's always, so for instance, I received personally the first warnings from Asia. So from universities we are collaborating closely with, they called me up and told me, you have to take this serious. And so this is also why I paid attention to that. We all witnessed how the EU dealt with it. So Italy was left by itself, basically. The borders were closed. Protective gear was not sent, and all those reflexes. And I think what people learned, and this was a learning and a dreadful learning all over Europe, is that if it gets tough, it's the nation state that saves you, and it's not kind of an international collaborative effort. So I think this is a real downside of what we were experiencing. On the other hand, I fully agree. Again, I think it's all about resilience, and the question is what the granularity of the discussion now should be. But I think you never know where such a situation would kind of have its impact, or where it will come from. So it came out of the blue, and so we had to work with what was available. And I think there are also beautiful and resourceful learnings we can take with us, that there has been an enormous amount of resilience and adaptivity, but it was not planned in a proper way. It just happened. And also the examples you pointed out. I'm more optimistic now when looking into the future. I think this international collaborative effect is now becoming stronger and stronger as we speak, also in all these COVID challenges. But I think the beginning was a bad start. It was a learning that should not be kind of repeated.
This open verse, I couldn't agree more. Franz, from your side, I mean, you had a very deep insight into the whole situation. Would you like to comment on what Markus said?
I think it always depends where you set the benchmark. If you go back to 2003, when SARS came up, I still remember that at SARS we were completely unprepared. When SARS came up, we had no single case in Austria. But it was a different situation. Also Ebola some years later. I'm aware of one patient who came to the hospital, a small hospital, who was not accepted because he had a black skin. He was from Africa, and they asked him to provide a written document that he's free of Ebola. The patient, we got the specimen, he was free, but he died due to meningococcal septicemia. But he was refused entrance to a hospital. This is only a few years ago. So for me, I'm somehow surprised to see how fast the hospitals took over, and especially in Vienna, we have to applaud Markus Müller and Michi Binder. They were even the first to give press news and set up the system. So for me, hospitals were the first who realized that this could be a problem. At this time, I thought, yes, they are afraid of their own situation, being overwhelmed, having beds on the thing. But this worked out perfectly fine. And for me, it's still amazing. I'm not aware of one hospital who refused accepting patients. I'm not aware. I'm aware of some nurses in the intensive care unit who did not want to stay at the department because they were pregnant or something. But overall, for me, it's surprising to see how the system was able to cope with this enormous flood of cases. So for me, resilience, as it mentioned, I simply applaud, and not only the AKH Medical University, who is one of the best on the world, that's great, but also small hospitals. They did not, I'm not aware of one hospital who closed the doors to the patients. And I think this is the huge success. So I think we have improved over the last decades. And once again, this is a 1 in 100 years event, and it's hard to plan it. I think we will even be more challenged for the future because COVID-19 has a very low fatality. What if we really have a disease with 3, 4, maybe 10% case fatality rate? We have to prepare. We will stockpile. We will increase the preparedness of institutions for closing borders, for relying on reagents from abroad. But I think the hospital system, the healthcare system, did a good system. You have to still remember, initially we closed down all the physician offices. The outdoor system completely stopped working, mainly being afraid of introducing this disease. It took a while to bring the general practitioners on board again. And for me, it was surprising that our staffs in the hospital was not afraid. And without having hospital hygiene teams, this wouldn't have worked at all.
No, thank you very much for these encouraging words. And this is a great acknowledgement for all the people working in the hospitals, from the medical university down to the little county hospitals. And would you say the same is true for all the surrounding countries? Have you seen similar movements in the countries that are now listening?
I myself am certainly not qualified to do it, but we always learn that some hospitals were overwhelmed. Once again, neighboring Italy, the Bergamo situation. But it's really hard for an outsider to assess it. Whether it's really this change in the hospital system, having private clinics instead of publicly funded clinics, whether it's really the nursing homes where patients were transferred for treatment because it's cheaper. I think we should be careful. This infectious disease is not as stochastic as some people think. It's a lot of chaos. It's simply by chance one area can be hit more than another one. Once again, I think we can assess Austria. For Austria, I think it worked very, very well. And again, we always blame we didn't respond to the staff in intensive care units. I think today in the lecture by Walter Hasi-Peter from the role, we saw that they increased the staff in the intensive care units by 200% simply by using all the trained anesthesiologists who had no work due to operations which were not longer performed. So I think the system, to me, I think we did excellent. And once again, without having these hygiene teams, I would have been afraid much more stress on the wards, because people, also medical staff, can be afraid of this disease. Remember all the pictures we saw, corpses laying on the streets, and I'm not aware of one hospital who failed to treat their patients.
Thank you very much. Hans, a short final statement from your side as a quality manager of Lufthansa and somebody who knows the healthcare system extremely well, not only in Austria.
Well, I would like to say a big thank you to everybody working in the medical system, because what every other system can learn from medicine is how to react quickly and efficiently to everyday changing evidences. And this is the flexibility and the energy and the manpower, or the hours the people work in the system without asking why me, how long, why is it today different than yesterday. This flexibility I have seen nowhere, and this is something I take back to aviation, and I would like to thank everybody who helped to succeed as well as we did. And I think we succeeded in Europe very well.
Thank you very much. Markus, are you still there for a final statement? No, Markus, I think, had to leave. Franz, final statement from your side.
COVID is a pandemic which was not expected since 100 years. I think Europe did quite well in coping with this problem, but COVID should not tempt us to neglect other challenges that have to be tackled. And whether it's climate change or antimicrobial resistance, those are two problems. And antimicrobial resistance goes hand in hand with nosocomial infection. I have no doubt that nosocomial infection and antimicrobial resistance situation need improvement. And we know that there are methods to improve the situation. I think we have room to improve it. And when COVID has gone and fear has gone, because fear is always a very, very bad advisor. Fear and blaming, looking for a guilty person, those are the two topics that don't help us. We have room to improve, there's no doubt. And I think if it comes to nosocomial infection, this will be a topic together with antimicrobial resistance, which will be on our topic for the next years, even when COVID in 1 or 2 years or 3 years is no longer our burning issue.
Thank you very much, Franz, for this final statement. With this, I would like to close our short and very interesting discussion round. Markus Müller already had to leave. He mentioned that at the beginning. And so I would like to briefly summarize today's conference. Again, thank you to the participants. Thank you to all the speakers. Thank you to the people who contributed for the publication for our journal. Thank you for the organizers and the team in the back that assured that all the presentations would be going. That was really a very, very encouraging first web conference. Nevertheless, I hope that in a year from now, in May 10 and May 11th, we will meet in person. Didier Pitet gave us a very good hope and a very good perspective that this could be realistic, despite all the facts that we have to consider. And what I learned today is that in this field, a lot has been changed, a lot has to be achieved in this corona situation. I mean, corona is not a silent pandemic like the healthcare-associated infections. It is a hurricane. It's a hurricane that stirred up the entire globe, and we have to face it. There is no other way. We cannot just leave the earth and then disappear. We have to face it. We have to tackle it. We have to handle it. But let us not forget the silent pandemic. Let us not forget the antimicrobial stewardship programs, the danger of creating multi-resistant pathogens. I mean, the WHO and also the G7, they have agreed that by 2050, this will be the death cause #1. And the more antibiotics get inactive, the more resistance to prevent infections to be spread. And this will stay. This will stay, even if COVID has developed into a regular disease, which we all hope. But this will stay. This is something that will be here tomorrow. And with taking COVID as a teacher is probably the best approach. And learning from this, increasing our awareness, increasing the hand hygiene systems, increasing logistic systems, increasing education and training, fighting fake news, fighting the infodemic. These are all things that we have learned in today's excellent lectures. And I would like to again thank all the speakers for their contributions. With this, we are 12 minutes over our timeline, but I think it was worth it. We had so much of interesting contributions from all the countries. And there is one final comment that I want to read to you because it's just fair to also give people a voice that put things in the chat. Operating room nurses were speed educated to COVID ICU nurses in a quick schedule. It all worked quite well. That is one way how to get the COVID ICU nurses in a short time. This is exactly what Markus and Franz and Hans said in their contributions. COVID was a teacher. COVID forced us to really train people. And let's take the benefit of this. Let's develop our hygiene systems in the future. And having said this, I would like to say goodbye to all of you. Thank you for listening. Thank you that so many of you participated from so many countries. And let's hope to see each other in person on May 10th and 11th next year in Vienna. Thank you very much.